Okay, seeing none, committee members, questions? Yes, Representative Ward.
Dr. Otto, are you still there?
Yes, I'm here.
Would it be logical, appropriate, or objective to call this a turf war, the way I see some of the testimony here? The small guys
Well-
versus the big boys, the dispensaries versus the independent growers, who, as the North Shore indicated, grow in the dozens of patients rather than just 5. Or if you get a better number than 5, if you don't like 5, how many should it be?
Well, to answer your question, your first question, yes, I think it has turned into a bit of a turf war. And I don't think that's necessary because the dispensaries are in a very unique position to be able to produce manufactured products, some of which require solvents and a chemical laboratory. And I think part of this turf war has also been propagated by a lack of supervision of these patient growth sites. And maybe it's a staffing issue, maybe it's a training issue. There are certainly experts in the community that could help the Department of Health learn how to do patient growth site inspections. But we need these growth sites to be inspected to help them become compliant. And from the patients I've talked with, they want to be compliant. They want guidance so that they're not going to be at risk of being raided by federal agencies. And I think one thing that I'm hoping that both sides of this turf war could agree on is that patients should not be making manufactured products and should not be engaging in commercial operations. So if we leave commercial operations and manufactured products exclusively to the dispensaries, which I think is very appropriate, and protect the ability of patients to grow flour and hash and rosin, which are very low tech products that don't require solvents or any chemical processing, that we would be able to serve the needs of patients, but also be able to protect the interest of the dispensaries.
Market share question. Of those who buy the medical marijuana, what percent go to the dispensaries versus those who go to the individual growers? Or I forget what you call them. The ones that are the independent, they're not the dispensaries. The ones that are being restricted to 5 patients. What is the percentage of the market share of the dispensaries versus the non-dispensaries? Let me put it that way.
Well, I believe that the most recent Department of Health data, and please correct me if I'm wrong, I think it's around 50% of patients have made at least one purchase at a dispensary, and maybe that's within the past 6 months or past year, I'm not sure. But the thing that we have trouble tracking is how often are patients returning to dispensaries? Are they just making one purchase and then they're not coming back because it's too expensive or the quality or the selection is not what they're looking for? I'm not sure we have accurate data on that. And then there's the other side is, well, where are these patients going? Are they going back to growing for themselves? Are they trying to cooperate with other patients? Or are they having to make use of the illicit market? So I think we could actually encourage patients to avoid the illicit market if we protected their right to grow in groups, in small groups together, groups perhaps larger than 5 patients on agricultural land that should be based on need. So groups being able to demonstrate that they have patients that can't afford dispensary products or want access to outdoor organically grown material, and have the need within the community to warrant the regulation of such a growth site. And that's why I think it's important for the department to adopt rules to make this happen and to have those voluntary grow sites so that growers want to cooperate. You don't want to be antagonizing growers and saying that you can violate their privacy whenever you feel like it and bring law enforcement onto private property. So there has to be a cooperation between the department and patients in order to make this work.
Okay, if not 5 patients, how many? What would you suggest? You said larger than
Well,
5.
Well, again, you could argue that this should be based on need. And perhaps that's something that could be included in the rules. I put 5 in my testimony because this is the number that keeps getting thrown around. So at least a step in the right direction would be 5, but there would certainly be instances where a caregiver needs to grow for more patients. And so that's something the department, I believe, could address in rules, but it does require a statutory change. And if this committee wanted to leave it up to the department or leave it open to exemptions by the department, then that's something you would probably want to include as an amendment in this measure.
Thank you, Dr. Otto. Thank you, Chair.
Okay, thank you very